Hi, and welcome back to another episode of STEM Seekers. I'm Sam.
And I'm Josh.
And today we're here with two anaesthetists, Dr. Lars and Dr. Stan.
Thank you for having us.
Yeah,
We're
thanks.
really excited to be here.
I've never been interviewed by high school students before.
Yeah.
New experience.
I think hopefully there's like an emerging trend where like high schoolers want to do things outside of just study and, maybe interview and see what's out there after high school. So yeah, hope maybe we're starting a trend or something.
Maybe.
Like just off that, that's so true. To think that, I think when you're in high school, all you do maths, English, physics, and chemistry. A lot of this stuff you'll never need again, and the real world is actually, composed of all these other things. Yeah. And now the real world is composed of sharing data and sharing information and seeing what's out there. So yeah, I wish that I had a podcast like this to listen to when I was growing up.
Yeah, but I don't know what your thoughts are, but I feel like when you're in high school, especially in Australia, it's quite restrictive in the sense that you do what you study what you study at school just purely for the ATAR and not really out of interest. Yeah. I don't know, that's how I'm feeling.
Yeah, I was told, luckily I was good at maths, and I think we both were good at maths. So if you were good at maths, you do 2 maths, physics is maths, chemistry is kind of maths,
yeah.
And then you get a good mark because you've done the maths stuff, and then you get into medicine, which is barely anything to do with maths.
Yeah.
But yeah, I agree. We did things to achieve an aim, but luckily we were good at those things. And yeah.
Like hopefully there'll be like a VC subject, which is kind of like leaning into the medical space. I mean, for me, I did sports science last year, and I felt like that was kind of close, and that's probably the closest you'll get from a VC subject.
Yeah, right.
It's one of the hardest things, I think, and probably a little bit controversial, because I think if you start specializing too early, you might lose the breadth that I think are important for other aspects of life. So I agree with you. Even within our specialty ourselves, when you look at the exams, the primary exam, many will argue where basic science, physiology, pharm, anatomy, in terms of its relevance when you're a consultant,
Yeah.
there probably is, I would say, only like 10%.
Yeah, absolutely.
And that in itself is like a little microcosm of what's happening macroly, at a school level. When you look at it, in terms of all the subjects and in terms of applicability for where you are as a professional.
Yeah, it's weird. Like I almost think, like now thinking back on it, man, the things I wish that I'd learned in high school were like realistic finance, how to make wealth. And that's just such a big topic, which everyone can start when they're a kid. What is happiness? What is well-being? How to have good relationships. Some people don't have basic relationship skills as well. Yeah. And who do you get taught by? Your parents or your friends, and they may not be the best parents or the best friends or whatever. So yeah.
Wow, School of Hard Knocks by Dr. Lars.
Yeah. No, our friend was telling us that's what we should do with this podcast, and it's like the next stage of it. But yeah, anyways, if you guys want to introduce yourselves, your age, what's your current role as an anaesthetist, and I don't know, what else do you do outside the operating room?
Yes, I'll start. I'm an anaesthetist. I'm 43 years old. Pretty much I went through high school in Brisbane, went to medical school at Monash, and then pretty much went on to the track of trying to get into anesthetic training, which I did, finished that. Outside, I think I'm pretty balanced. So what I do, I play a lot of music at a very average level. I do a lot of fitness at an average level. I just love doing lots of different things. I recently started doing improvised comedy. So we produced our first show last weekend. And we had one sold out show, which sounds great, but if you have a small theater of 30 people, it's actually pretty easy to do.
That's awesome.
That's been fun. So I think once back in the day, everything was just study, get into anesthetics, obviously, have your friendships and have your, travel and fun. But now that journey is, I think we're kind of at the top of our game in terms of anesthesia. And now it's like, there's so many other things that are really interesting and fun to explore. So yeah, like this.
Yeah, I mean, that's great that you have a lot of time outside, just work to go venture into different things and pick up new hobbies like improv comedy. Yeah. And yourself?
So I'm actually a little bit older than Lars, so some might say I'm your mentor. Yeah, I'm 44. Yeah.
Wow, so much older.
And it's funny, Lars sort of describes themselves as an average musician and average athlete, but trust me, it's all relative, isn't it? Because compared to you, I would be what would be considered sort of below average on sort of both.
We're looking at the wrong scale. Like if we just looked at we're both here and the elites are up there. Anyway, go on.
So very much like Lars, I'm an anaesthetist and I do work in both public and private hospitals, but primarily public over at the Western. And, my interests specifically now is a lot on education, mentoring, and also trying to create sort of solutions to problems. And as you know, I've sort of created a startup, and yeah, it's been a wonderful journey filled with lots of ups and downs, but lots of learning experiences as well. And I think that's sort of been, I think a big lesson in my life in terms of, you just never stop learning, no matter where you are, at whatever stage of life you are in,
I think there's a really great video by Tim Minchin, and one of the things is with 9 rules for life or something, and they're not what you'd expect someone who's a famous celebrity to say. One of them is, whatever you do, be a teacher. Even if you're not a teacher, be a teacher. I don't know if you've seen that video.
I've heard of it before.
Definitely watch it. Just Google 9 rules of life or 9 lessons for life by Tim Minchin, and it's like, oh yeah, if you have something you've learned, just pass it on. And that's like what we do with anesthesia. And it's actually great because we know that from a point of view of, we want our trainees to be so good, and that first of all, we can relax when they're taking ownership of a case, but also we know that when we're older, or even now, they're going to be anesthetizing us. So just make sure you train up everyone to be really good around you.
Yeah. I mean, we'll get back to what you're saying about teaching, because I think that's a very big part of who you are as an anesthetist. But why did you get into anesthesiology?
Yes, anesthesiology. So it's a funny term, like, first of all, no one can say it, so that's a problem.
The mouthful. They got stuffed it up 3 times.
In America, anesthesiology.
Yeah, same thing. And in America, like around the world, sometimes nurses are called anaesthetists, or there's anesthetic technicians, but we're like the American anesthesiologists. So like a lot of things in life, it's an accident, like who you meet. So I met someone who would rave on about how great anesthetics was, and I don't think he had great evidence for it, but it just seemed like he was a great salesman. And he said, and this sounds a bit cringy, but he goes, yeah, Lahiru, anesthesia is like the SWAT team of medicine. When the shit hits the fan, the anaesthetist comes in, and there's a few doctors that do all the kind of the life-saving critical stuff, and anesthetists are one of them. And when I was doing my internship and residency, I was like, yeah, it's true. The anesthetists are so relaxed when crazy stuff is happening, the patient's about to die. And I just thought, yeah, that looks good. I want to do that. But then when I got into the job, it was lucky because all my weaknesses were mitigated from anesthesia. So if you have ward rounds with lots of patients, I just didn't find that as satisfying as treating one patient at a time, sorting out the problems. You have moments of sheer, like not quite stress anymore, but back in the day, the intense moments, you solve them, and then you have a bit of a bit more of a relaxing time. Whereas a GP, or they have this longitudinal connection with the patient, or physicians and surgeons, often they have very long connections with the patients. And that responsibility on a very long period of time is like a marathon, where I feel like I'm more of a sprinter with the responsibilities and things. So
after you finished internship, did you decide anesthetics was going to be your career?
In internship, we had an anesthetic rotation.
Yeah, okay.
Actually, no, I had finally in medicine, I thought I was going to do surgery. Did a couple of surgical rotations, and an internship, did an anesthetic rotation. I think over that period of time, I thought, whoa, one surgeon was in hospital almost every night.
Yep.
Just flushing catheters, trying to get, there's urology, and just getting clots out. That's what it was terrible. He was a lovely guy. He was so happy and cheerful. I'm like, I do not want that to be my future. And so I had great experience from one, and a couple of bad experiences from another.
Yep.
And again, based on bad evidence, I chose anesthetics. But what I'd suggest you do is you try to talk to a consultant who's after training, living the life of a surgeon, anesthetist, GP, whatever profession, and go, what's your life like? And does that suit the way I think I know my personalities? For example, a GP, if you hate talking to people, if you're not extrovert, if you don't need too much downtime, then that's great for you. But if you really don't if you lose energy from constant interactions, don't choose the people profession just because you think it's good. If you're not dexterous, if you can't play computer games well, I don't know if that's an analogy, don't be a laparoscopic surgeon, right? You need coordination if you're going to be a surgeon. If you hate the sight of blood, or you don't you might not know this yet, but if you don't like extremely stressful situations, if you're not charged by the fact that maybe you're playing sport and there's a bit of a crisis and you need to score a goal, and that just terrifies you, don't do anesthetics. There's certain things that you'll know about yourself, and you should know that. Hopefully you'll realize that, and you should ask those questions to yourself. Do I think that this is a job I could deal with?
I think, that's spot on. I think
Thank you.
Yeah. Like when I look back at my sort of career in terms of how I came into doing anesthetics, very similar. Because when you go through medical school and even internship, you don't have a anaesthetic rotation. And very much like you, sort of come out, you're exposed to both the surgical field, the medical field, and normally just one of those two streams. And at that time, I still remember vividly, I wanted to do orthopedics. And again, in theatre, and you're very right in terms of what's your personality and how does it suit with regards to the job? Because ultimately, I think what would be really interesting would be when you discuss, let's say a surgeon and talk about their experiences and why they chose what they want to do. Because for us, and for me specifically, I still remember, and it's going to be a funny story, but obviously, I was in theatre as an intern doing orthopedics, and then we're doing a hip replacement. And then I was asked to hold the hip in a specific position. And obviously this was the time that was, I'm showing my age now, but this was, 20 years ago. And hips were obviously done a little bit differently. And I remember holding this big leg. Yeah. And ultimately, there just wasn't any rest. And I was just going, and I wasn't the fittest, as you know, I'm below average in terms of last fitness. I'm holding this leg, I'm going, what the hell's going on? I'm getting really tired, but at the same time, I know it's really important for me to hold this leg in this position here because he looks like he is stressed. And then out of the corner of my eye, I saw someone just, relax, obviously looking at the monitor, focused, calm. And I went, you know what?
I want to be that guy.
I want to be that guy. That is my job right there.
And again, that was bad evidence because as a surgeon, once you've graduated, once you've stopped holding the leg, you start operating. Yep. And we just didn't want to, I didn't want to be that person holding retractors.
Yes.
Being so bored.
Yes.
Or and it's a problem with probably the teaching system where if you're in surgery, the surgeon does their thing and they just ask you these random questions that have nothing to do with the learning or what you need to be doing on the ward. Like this one surgeon would ask, what does pilonidal mean? What are the Latin roots of it? I'm like, is this? It's unright. Pilo meaning.
But it's so true in terms of, I think you really enjoy as an anaesthetist performing under pressure, performing under high leverage moments.
Yeah.
And you don't sort of discover that until you sort of do the rotations involved. So as a second year, once I sort of knew that probably critical care with the defined sort of start, end times, and in terms of what the work was required, was probably what I was going to choose. And in those rotations there, you would do intensive, ICU, intensive care, emergency, and also an anesthetic rotation as well. And within those fields of critical care, that's when you sort of pick and choose which one of those three you decide to do. And I think you sort of meet the right people who inspire you, educate you, mentor you, and that's how I decided to do anesthetics.
And I want to take a step back actually, because I remember, just for everyone, everyone's in year 11, 12, I imagine, listening to this. There was a moment when I was so tired in year 12 trying to, organize, getting the right marks in the study, doing all the extracurricular stuff because you know that matters and you love it as well. And then also the interviews and I was applying into state, timing, all those things. I remember at a certain point just going, I'm probably going to get, in Queensland it's an OP1, I'm probably going to get that mark. I could just relax and do a very respectable degree that feels okay. And it won't be too, you feel like shame if you don't get what you're trying to get. But I didn't, and I said, I'm just going to crack on. Probably because my sister was already doing medicine, and I was like, I've got to compete with her because that's the stupid metrics that we judge ourselves on when we grow up. And then I did it, and I'm so happy I kept on going because my mental health was fine. I didn't really think about it too much. I just kept doing it. But to think that if I didn't take that challenge, I wouldn't be the person making the decisions. Like when you get to be the person at the coal front, you're the consultant, it's your responsibility. And I'm glad about that because if you trust that you're, pretty good and you will get there like lots of other people before you, then you get to be in that position and you're not letting someone else do that when you think you'd be worthy. Imagine if you're a good soccer player and you I don't want to have the stress of being the striker and someone else gets to do it and you could have done that, you could have scored that goal. I'd rather do that and fail now.
Yes.
And I only know that now. I'd rather have,
go and have that attempt
that, fail, and then, okay, you know what, that wasn't for me.
Yep.
To actually just go, no, I'm afraid of trying and I'm just going to sit back. That's not my person. That's not for everyone. Some people just want to have a chilled life. My dad
and
was
that's
the most
okay,
person. He was so much easy about that, but for me, I'm glad
different roles, isn't it?
Made those choices.
Yeah. I was going to touch on, I was listening to one of your early podcasts and I think you were talking to a medical student and talking about, getting into medicine and what was involved and doing, I think, UMAC,
UCAT, yeah.
UCAT now it's called, isn't it? Training from year 10. And I think he was talking about, retrospectively, probably he wouldn't have spent the time sort of doing that. Look, very much like what La was saying, I think it's all about the challenge. Yeah. It's all about setting yourself goals and trying to attain them. And whilst achieving those goals may not result, and when you sort of come out of it, you're like, actually, I didn't actually need to do that to actually achieve where I am today. Yeah. It's actually the process. It's actually the process of setting goals and achieving them. And I think that's what I think is the most important thing in terms of, when you look at your teen years from 10, 11, 12, is challenge yourself. Yeah. Challenge yourself, see what you can attain. And I think what La was saying in terms of if you fail, how you go about framing that, and how you go about learning from those experiences and whatever comes out of it, right? Trust me, you will come out on top. You will succeed no matter what. That's the mindset you want.
Just keep failing at things, and that's a really good thing.
Yeah.
Imagine everything you did, you succeeded at. Then you're like, oh, well, that means were you really shooting for something? By the way, this is all very achievement-oriented. I think there's so many more important things like looking after your mates and your family.
Yeah.
But yeah, this is...
Goals itself, I think. Yeah.
That's a goal in itself,
Yeah.
Yeah. But I mean, do you think that this, how you get the competitiveness of getting into medicine has changed a lot in the last couple of years? Is the admissions a lot more different?
It's interesting. I'll say on this first that I think that it's always been competitive. I think when I went through, it felt like it was competitive. And again, when you sort of talk to, your mentors, they will say, back in my day, it was actually quite easy to get in, but I'm quite sure also it was actually quite competitive for them. And in actual fact, if you actually listen to their stories, what they had to go through, some of them had to go overseas to train, multiple fellowships or multiple specialties and then come back. I think it's just equally as challenging. I think where the perception is that competition has increased, is that everyone's knowledge is getting more and more.
Yeah.
Everyone can do things more efficiently and can achieve things at a higher rate. And what I mean by that is that certainly for our trainees, when we look at them getting to anaesthetics, a lot of them come now with published papers, doing different courses. And it's not because that they've spent more time doing it. It's because the processes involved of achieving those goals or those targets have actually become a lot easier. Yeah. When I say easier, a lot more well-defined. It's the same thing again, in terms of getting to medicine or perhaps even getting to whatever specialties you want. It feels more competitive because you feel as if you need to do all these things. And versus, back 10 years ago where you didn't have to do all those things. Well, 10 years ago, the struggle was no one actually knew how to go about, doing UCAT. There probably wasn't a UCAT course, 10, 20 years ago. Whereas now everyone sort of goes, oh, actually, there's a demand for UCAT. And everyone feels, I need to do the UCAT course. And that's where that perceived competition is. But it was always been there. And I think the main thing is, as Lars said, with life and with competition, as long as you feel that you're getting better each day and you are setting yourself goals, and even if you don't achieve them, you feel as if, look, I want to just be better. It doesn't matter where you end up. You'll be successful. And I think, the most important thing is don't feel as if you are set yourself into one defined role. I think the amazing thing about this world is, and what we sort of see, so many opportunities to be successful. It's just immense.
To take a step back, because a lot of people listening, some of you will get into the career you want, some of you won't. Just know that the thing you want already is you're a person living in Australia. You've already won at life. That's the perspective you need. I think everyone needs. But along that journey, hey, shoot for the stars, shoot for whatever, see what happens.
Something our first guest said is, if you want to become a doctor, you'll become a doctor.
Yeah.
You have a one bad SAT grade, it won't mean anything big in the long run. Do you think that's true?
Absolutely, 100%. Ultimately, if your passion is to become a doctor, there are so many opportunities now that this world has provided that you can achieve that. And what I mean by that is, back then you kind of felt if you never got in as an undergrad, that was it. Yeah. You kind of felt, oh my God, I need to go overseas perhaps. But nowadays, there's a lot of postgraduate courses, and certainly I know that medicine itself is evolving in terms of the people that they want in them. They want people who have different experiences, come from different backgrounds, and that might also mean more mature age students. I think what's really hard is when you're in the moment itself it sometimes feels like you're a loss.
Yeah.
Do you mean?
I had a mate who, I'm pretty sure he went to Malaysia or Fiji to get his medical degree. He just really wanted to do medicine. Hey,
And
you got
just
it,
did it,
came
right?
back,
Yeah.
did the AMC test to get back in.
And now practicing here and successful.
Obstetric consultant
Yeah.
up in Queensland. Yeah.
I totally understand. When you are, that age, 17, 18, thinking about losing a couple of years, in order to be where you want to be seems quite long, right? But honestly, when you're on our side, mid 40s, you're like, you know what? I would have enjoyed perhaps 3 years of not doing medicine and perhaps doing something else. Like the life lessons you learn, I think, are immeasurable when you reach that point in your life. So life is unique, experiences are unique. What your journey on is very specific to yourself.
Yeah.
It's in you, whatever you encounter through your life, you will always have value. And, you'll always have someone else that you can mentor, you can teach. And I think that's the beauty about, medicine or any other profession that you want to do, is that you see so many success stories from so many varied backgrounds.
Yeah.
Cool. I think we'll reframe from going from talking about medicine as a broad concept and more talk about anesthetics.
Yeah.
So what does an anaesthetist do in the hospital?
And you've good question.
Yeah, but you kind of highlighted it that, you look at the monitors, you inject the sleepy stuff. What else is there?
So I'll give you the rundown of, say, an average day. First of all, there's public and private anaesthetists, and some anaesthetists going to do pain and teaching, research and education, all that stuff. But the day-to-day of what we do, so if you're having surgery, essentially you, as a patient, you generally want to not remember anything. You want to be pain-free, and the surgeon needs you to be still enough that they can operate effectively. So the brilliant thing is that over the last many years, hundreds of years, they've created these medications that are very effective at getting you asleep, analgesics, pain-free, and paralyzed. Unfortunately, when you give those drugs, they're really blunt instruments. So they do the sleepy stuff well, but they also mess up your other organ systems in the sense that your blood pressure drops, your heart might not work as well, you stop breathing. And so the anesthetist's role is, okay, we're going to give these drugs that make you asleep, and then we're going to, there's all these problems that we know are going to happen or might happen, and we will fix that, and that's what we'll do, train day in, day out to do. Sometimes the surgeon or the patient will have a particular problem. They might lose a bit of blood, so okay, we know how to solve that blood loss problem or that anaphylaxis allergy problem or whatever problem happens. And so that's kind of the broad scope of what an anaesthetist is there for, to make sure that you're safe and psychologically not impaired during the operation. So yeah, when we get, for us, some people work more shift work than others, but we probably just work 8 a.m. to 6 p.m. Full-time work's about 38 hours a week. Training, you might do up to 70 hours a week. And then, we go in, we know the list that we're doing, we'll know the patients. The patients are often either come on the day of surgery or they've seen in a clinic to optimize them and make them as healthy as possible. And we just have a chat with the patients, say, yep, any problems here? Great. What are your allergies? What medical problems do you have? Great. We'll sort that out. We tell them what we're going to do. We put a drip in, give them some oxygen, get them off to sleep. And then we're just there the whole time, making sure that all those bad things that could happen don't happen. And then we wake them up at the end, obviously. Now, this all sounds pretty crazy. To be rendered unconscious with someone cutting you open sounds a bit crazy. And yeah, it is. And that's why it's just so amazing to be able to stand on the shoulders of geniuses to be able to do this. So we can just, keep someone safe and be there and make sure bad things don't happen. And because of all the advances in teaching technology and whatever else, the average anesthetic for most people is 10 times safer than driving a car on the road. So the anesthesia itself is extremely safe, and that means that the rare things that happen, we're there to prevent these very crazy things that happen sometimes very rarely, or in really, really unwell patients can happen more commonly. But that's kind of the job. We're there to really just ward off the evil spirits.
But the time that you jump in, that's usually due to human error or due to the actual drug?
Yeah, that's a good question. Human error happens in every field, but I'd say that say we give this drug called propofol. Yeah. It's the drug that Michael Jackson died from. So under the hand, in the non-operative setting without an anesthetist, it's a really dangerous drug. But we give propofol day in, day out like it's nothing, because we know how to deal with the complications of it. So in the wrong hands, something is extremely dangerous, but in the right setting with professionals, giving all the crazy drugs that we give, are extremely safe.
Can you give us like a specific moment in the surgery room where like you had to act and do something in that moment? Or?
Yeah, I mean, I'd say
Lots, yeah.
there's so many. To give you some general ones, obviously we don't want to talk about anything specific. I've had quite a number of patients have anaphylaxis, which is a severe allergic reaction. Your lungs become asthmatic, kind of. Your lungs just seize up, so you're not passing oxygen through. Your blood pressure drops because the fluid just gets extravasated into all your tissues. And so that's really catastrophic without treatment, without things like giving oxygen, ventilating the patient in a specific way, giving adrenaline, which prompts your blood pressure up, stops the cells causing this enzyme to release and just destroy the loss of fluid, and giving liters of fluid. To do that, we put a big drip into a big vein and just get someone to just pump in fluid. So when those moments happen, it's like, oh crap, that's happening. Oh, yep, this looks like it. Check the variables, check the monitors, listen to the heart, lungs. Okay, there's a rash, great. This is probably anaphylaxis. And then we just kind of jump into gear, call for help, get all the resources, and be superheroes for a day.
I think the best analogy in terms of a lay person, and we were having a chat about this on the way here, is that you consider us as pilots on a plane. So when you think about a plane taking off and landing, those are probably the most intensive moments in terms of where a pilot is actually in control of the plane. Very much so like with anaesthetics, where when we get the patient off to sleep and when we wake the patient up, those are probably two of the highest, riskiest moments during the patient journey. Once you're sort of at cruise control or altitude, most of the time, everything sort of runs to plan. And as Lars said, it's a combination that we're so advanced now. And, in terms of the drugs we use, the machines that we use, we can control those factors that are there. The surgeons are like the weather, unpredictable. And, sometimes it's just like clear weather and, you get from A to B without any issues at all. Sometimes there's turbulence. And with those turbulence, that's when you switch off the autopilot, you take over the controls, and you navigate your way through the storms. So very much like, the anaphylaxis.
Someone told me this is an analogy of like, it's like a pilot, except it's like you're flying a plane and a terrorist is attacking every single time. And sometimes they just remove a seat or whatever, and other times they take a wing off.
Yep.
That's exaggerating.
I wouldn't say every single time. And in actual fact, I think the statistics for plane flying...
That's completely exaggerated. I'm just, for the audience, we're joking.
And, I think the statistics for plane flying, they say it's safer than driving a car, isn't it?
Yeah.
So very much like anaesthetics, again, very, very safe. And I think, in terms of what we do, it's really about getting the patient from A to B as safe as possible.
So what it seems like in terms of the stress level compared to, like, say, a surgeon is that when you're in the operating theater, like the surgeon's constantly operating at this like very high level of stress with like everything that they do. But with like an anaesthetist, it's, pretty cruise up until that point where they have to like jump in.
Maybe a good analogy for this is the time from stimulus or action to disaster has certain time frames. And in some professions, it's very, very long. Like, for example, some medical professions, you might prescribe a drug and then the patient goes away and maybe that drug over months will be the wrong drug. That's a long time frame with lots of people involved in making sure that the patient probably okay. In the anesthetic setting, when things go wrong, the time from action to the disaster is very narrow, and that's why we're there the whole time with the patient. There's no time we're not there. And so when things do happen, the stress can be pretty high because you're like, in not a bad way, it's like, okay, that's happened, boom, 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 we just get into gear. But the surgeons, I'd say, there's so many different operations, and some surgeons are extremely good at certain procedures, and some are less common procedures that they probably need to be more in tune and think. For example, I work with lots of cataract surgeons. Some of them make it look effortless, and others seem to take a lot longer. I'm not sure why. And some of them look more stressed. And maybe it's because of the patient population, or it's a harder cataract, or whatever. So I'd say, in general, surgeons are more at we're at a sudden level of stress and then cruise control, whereas they're at a constant lower, hey, we just got to get this done, cutting. And sometimes the surgery is so rare or hard or high risk. Like, say, a gallbladder operation is common, pretty easy for most surgeons. But if that gallbladder is a tumor invading parts of the liver or this big vessel, like the IVC, which could bleed out suddenly that normal operation is now far more stressful because they're cutting so finely that they want to make sure that no blood loss happens. So yeah, I think that's the variability of
Yeah. Look, I think with stress for any consultant specialist, the aim is that you want to reach a level where what you do day in, day out is actually not stressful. And the way that you actually go about doing that, and this is one of the human factors that we sort of discuss about, is that you want to be able to sort of know what are the steps you need to do when certain things happen. So, as Lars said, when certain scenarios happen like anaphylaxis, you immediately know, all right, we've got to manage airway, breathing, circulation. And I think this comes with experience, this comes with sort of that time process as well. So much so that I can say that, for 99.9% of scenarios now, it's certainly not stressful, but that's because I know that in my head, I've got steps in order to go fall back into for what happens. And I still remember, my first night as an anaesthetic registrar, I remember I had this challenging airway and I could feel my heart rate just, start increasing because it was, in that moment, it was such a high leverage moment where you're sort of going, if I miss this, you're going, I don't know what's going to happen. And it's actually the unknown that is actually the most stressful. In actual fact, because you're going, if I don't get this in, the worst could happen and I'm not sure how to save this operation. Whereas now as a consultant, you're very measured in your approach in terms of working your way systematically through, all right, if this doesn't work, I can do this. If this doesn't work, I can do this. And you want to be able to do it in a timely manner such that you almost can predict outcomes. And because you know what the outcome is, you're not stressed at all. I'm sure very much when you do your exams, at the moment, there's a high level of stress, but as you continue to practice and perform and you almost know what to expect, you're certainly less stressful.
Yeah, and it's an unknown. So there's certain times where I'm like, oh, wow, I don't know that scenario. So I will feel the heart rate go up. We had a case where, we both did this case where it was the heaviest patient I've ever seen. This patient was 280 kilos.
Oh, yes.
And I've got to say, it wasn't like my heart rate jumped, but I knew that I had never seen this before. And I was on edge to thinking, what are the unknown unknowns that I'm going to be dealing with? And, we were both there. So we're solving problems and doing things. And it went, for a case, it went really well. I've never seen this physiology before. And, but the funny thing is the job, some people look at our jobs and go, whoa, that's crazy that you're literally restarting a heart that's gone into ventricular fibrillation or had a cardiac arrest, or you're pumping liters of blood in and liters of blood's flying out. And that is, in a sense, stressful. But when it's within your capabilities and your system's capabilities, it's actually not a bad stress. It's stress that I think we would almost in a sense enjoy. It's like a motivating, energetic stress. Whereas the stress I had as a training doctor, having to do, not knowing that I couldn't do all the tasks I needed to do in a day to please my bosses, or actually, the most stressful job I've had, it's going to sound weird, working at Kmart doing returns of clothes for 5 hours. And I couldn't find there was such a big, so I couldn't find, I was doing nothing. I was so stressed because I couldn't do my job because it was a really hard
job.
Yeah, it sounds so trivial, but not being able to meet the expectations of the system or the people or whatever, my boss, that's more stressful, and that doesn't happen now. Even though the job looks crazy, it's not as stressful as that job when I wasn't able to do my task.
So it definitely seems like you guys are now experts in your field. You guys are definitely, I guess, a lot more calm whenever you're in surgery. And I guess that's why you guys are such good teachers, and I guess you have the time and confidence that you can give back to this younger generation. And I think that brings us to your, I guess, kind of like side hustle in a way. ABC of anesthesia.
Yeah.
I'll get it right by the end of this. What was the idea behind this?
Yeah, so for me, ABCs of anesthesia was a bit accidental. I started teaching things that I thought weren't being taught a lot, or literally you go into theatre and you get a new trainee and it's like you say the same thing over and over again. And I thought, oh, look, why don't I just make a video about this? Or why don't I just make a little tute about this? And if they come in and have a question, I go, just watch my video first and then come back so we can talk about higher level stuff. So I started, if you have a look at ABCs of Anesthesia on Instagram and YouTube, for your audience, they probably won't care about it at all. But you know what? We have a lot of interview tips on the ABC's Anesthesia podcast, and that I think could be very useful for your audience. But the thing is that when you're doing it for your own interest's sake, like it's a thing I'd be doing anyway. The only difference is with me and maybe lots of other consultants is I've recorded it and I've put it online for people to use and hopefully utilize. And then it just, because of COVID and I don't know what else, I just kept putting out videos. And then it became, people started watching these videos and suddenly it becomes a thing. And like, I don't think it's that special. Like if you do lots of reps of anything, if you teach a lot, it becomes better. If you keep refining it, trying to improve it, you become better at it. So having that constant feedback and even the criticisms is so useful. I don't know if everyone, like, you might be worried about people trolling you. Like, it's one of those funny things where if you just come from a place of, hey, I'm an anaesthetist, I don't pretend to be able to do anything that I can't do. So any criticism feels funny. Like I was showing a difficult cannulation. Sometimes we have tiny veins and in our patients, and that's the only thing you've got to get. And that's a very difficult or technically skillful task. So I'm just demonstrating what I do and how I do it. And someone goes, who's this effing guy? The ward boys in India could do that. And I was like, oh, that's a funny line. It's like every time I get a criticism or troll, that's funny. I just screenshot, put it in a folder, and I have a bit of a laugh at it. And then other times you have really good constructive feedback, and I'm like, oh yeah, I did make a mistake there. So I'll just take the video down, upload with the correction, done. It's really great to be humbled because no one's perfect and someone corrects you. If someone, I think being online is really good for that, because if you're not online, you're just teaching the people.
You're putting yourself out there, aren't you?
Yeah, but people agree with you the whole time, even when you're wrong. That's more dangerous because then you start thinking you're better than you are. So
Lars started ABCs of Anesthesia probably before COVID or just after?
Oh no, July 2020 was the first YouTube video.
Yeah.
But before that, I'd been teaching not under a company or anything, but I was just teaching freelance.
Online, right? With the final part?
No, in person. Like we would hire out a room at Wesley College, actually. That was a great venue, and it would, I provide catering. I first started in a library, Turk library, and I literally bought this little basket and put teas in it and bought an urn and just charged a bit of money to some and just advertise. And it's just like when you see something when it starts, it's so budget. It's so,
you got to start from somewhere, right? And you see how it grew and you see the story.
That's right.
But with regards to where we've built Anesthesia Coffee Break, which is our podcast for anaesthetists, and that's something we've done together. And Lara and I actually share very similar values, which is why I think we work really well in terms of he's a great educationalist, passionate mentor. And I think the third value is that he truly believes in equity. And when we talk about equity, it's making sure that everyone, no matter what your circumstances are, has the access to educational materials. One of the big, I think, things that has sort of changed in my lifetime is technology. Technology has allowed, access, freedom of access. Because prior to all this happening, it was always behind paywalls. And when I say paywalls, it's like, if you don't go to a certain university or school, or you don't belong to a certain group, you don't have access to these resources here. And I remember, when I went through my training, it almost felt like a battle of resources. It's like, what resources have you got? What resources have you got? What textbook have you got? Whereas now, over the last, sort of 5-10 years, you start realizing, actually, you know what? We just need to make it freely accessible to everyone, make it a level playing field, and let everyone feel as if they can improve and get better, And I think that's the main driver of why we created Anesthesia Coffee Break. And also my little side project as well, which is the Adrenaline Memories, which really is looking at mentoring and helping, our trainees get through the exam. And for me, it's been a journey as well for myself to sort of understand that I can't always promise success. I think that's been one of the really hard things for me is, when I first started this with La, I really wanted everyone to pass on their first go, And
you've moved the needle though. I feel like
it's hard,
for the immediate people, you've made such a difference that immediate cohort, you move the needle, but like it's like this thing on average, people still.
It's still challenging for them. And, the way that I sort of frame it now is that it's a journey.
Yeah.
Like, it's a personal journey. And that's why I'm really big into making sure that, you understand that your experiences are your own and we need to respect them. And certainly, we can give you advice, but the advice sometimes, it may not actually resonate with that person. And that's why I'm really big in, people making sure that they completely respect and understand that this journey that they're on, it's special. It's special in terms of it's unique to them. And the things that they learn, somewhere along the lines, they're going to be mentoring someone else in a very similar position. And they can actually speak to all the experiences and probably the stresses that they're going through and help them through, that exam too.
Actually, what's really special about this podcast and for you guys is like the fact that there's going to be people out there who don't have access to talking to a surgeon or an anaesthetist, right? So like the fact that people, your dad and
I think that was definitely the main reason why we created this. Because, we're lucky enough that I have the connections with medical professionals. Our school invites people in. And, there's a lot of people who, they can't talk to. They don't have a friend who's a doctor. They don't have a friend who's a pediatric dentist. They don't have this like whole network of different professions. So their like perception of STEM is just very, very limited.
Yeah.
So it's 100% right that, the internet has opened up this, this pay barrier, and information is so much more accessible now.
Yeah.
But do you think that, I guess, a part of the reason why you guys have to teach in the first place is that there is such a big skill deficit in new anaesthetists?
No, I wouldn't say that. But I think I always thought that we could. The training program's like 5 years, and we have a really, really rigorous program. Like the exams and the training, the volume of practice, the numbers of things you have to do, and the assessments and logging it all. So by the time you finish training, you're going to have a good anaesthetist there. But I always thought I could just get them there quicker. Yeah. So I think I just wanted a lot of sort of introductory anesthesia stuff. So the skill deficit is there when you're starting anything, but why don't we teach it in a different format?
Right.
And I've just had
quicken the learning curve.
Yeah, quicken the learning curve.
And going back to that idea about stress.
Yeah.
I remember still first day, even as an internship, I remember holding my pager and just being so stressed, and having that pager go off and feeling as if like, I don't know what I'm doing. But what La has created is that familiarity, is that understanding in terms of what to expect. Yeah. And I think that's the whole process, is that when you know what to expect, your stress levels come down so much. And I think that when that happens, you can perform better, you can interact better, you can be your true self. So, these are all the things that I think, are the goals of, what you've done with ABCs of Anesthesia, which is why you've got yourself like a little plaque, haven't you, with like the YouTube plaque? Yeah. He's got like what, the silver one? Or...
We don't have to talk about that.
No, it's amazing. I'm surprised you don't actually show it up when we do our podcast. Oh, do you? I mean, hold on.
No, I don't. So it's okay.
Yeah. But check out his website, ABCs of Anesthesia.
You guys are like the Khan Academy of like anesthesia.
Yeah.
Oh, that's an epic channel. Like you learn anything. Yeah.
But that's great. Yeah. So, Dr. Sen, you also have your own kind of side gig as well with Animate.
So look, with Animate, what I've done is, again, leverage technology in order to sort of help out with administrative processes. And one of the key things that has changed over the years, which I'm also trying to implement in education as well, is obviously AI. And I think, you guys at the forefront in terms of being able to sort of utilize it. And I see so much potential in that with regards to, I think creating efficiencies. And there are so many other goals that are associated with what I want to do with Animate, and really sort of, lends itself down to making sure that, patient care is at its optimum, or it's at the center of what we're trying to do. And, by being more efficient, what we can do is then give patients information early, helping them, educate them, inform them, making sure that they can make sort of informed decisions. And I think sort of understand the process that's involved in their perioperative journey. So that's like a project that I'm sort of working on. And we're working on that through sort of, trying to work through the flows of what's involved with administration with private anesthetics. Yeah. And we're doing that through our sort of app called Animate.
Yeah, so it's definitely targeted more towards your patients then?
It's targeted towards anaesthetists, but the way it does it is that it's able to sort of get information, sort of use AI to sort of understand that, populate that information, and then also gives the anaesthetist, the tools in order to be able to sort of communicate with patients electronically. So that will often involve like a text message or an email to say to patients, come, I'll be your anaesthetist, and then have them go through a portal where they can learn about their anaesthetist, learn about what's involved. And this is just for anesthetics.
Yeah.
For me, the vision is, 5 years from now, to have that all-encompassing. So, my vision would be that this link isn't just for talking about the anaesthetist, but also, understanding in terms of what's involved with the surgical journey, with the hospital that you're going to, the recovery process. And that way, it just forms like one tenant or one sort of portal for patients to sort of go through. Because ultimately, currently, the healthcare is so segmented with all the different specialties trying to communicate with one person. And you can talk to patients, it's very confusing for them. They get multiple information from the surgeons, from the anaesthetists, from the hospital, pathology, radiology. And sometimes there's a lot of duplication of questions. Surgeons will ask them the same questions that the anaesthetist will ask them, that the hospital will ask them, and patients get frustrated. I totally understand that. And I'm trying to solve that through this process here.
Yeah, no, it's great that you guys are giving back to what you guys have, what you guys love, and really encouraging this next generation and making it better.
Yeah, and we love this patient's focus, but let's take it a step back. What does a typical day in a life of you guys in the hospital kind of look like?
Yeah, so public hospital, what we do, we arrive in the hospital, we know our theatre list. It might be a orthopedic list or an eye list or a urology list. We see our patients beforehand, we just talk through them, find out about their medical history, allergies, heart problems, lung problems, etc. Put a drip in, which is one of those needles that goes in the vein. Yeah. And then we get them off to sleep and just make sure that we're taking care of them through the whole process and then wake them up. Yeah.
Is there most a lot of pre-op planning that goes into each patient?
Yeah, so depending on how complex the patient is. So if someone's like, say, any of us going for an operation, we can just turn up, really. Just a questionnaire is all we need. Sometimes you get a patient with some severe lung or heart disease having a really complex operation, and maybe that operation is so high risk that we really need to have a discussion. We need to kind of figure out whether there's a perioperative risk, what's the risk of having the operation, and whether the benefit is worth it for the patient. And that's a really complex discussion where you're like, you have a 20% risk of death, and you have a 50% chance that the procedure is going to be of benefit. And how do you balance that as a patient? Because you might be suffering right now. So that's a really complex discussion, and probably it's one where we get the patient, the surgeon, and the anaesthetist, maybe even ICU, maybe cardiology. Everyone kind of ideally should have a conversation, and then we kind of present that. The way I present it to the patient really is, what's your happiness level? Like, where are you now? So, for example, if someone was for the trickiest patients, where you're not sure whether it's a high-risk operation and they've got a high-risk condition, you go, what's your life like now, and will this operation improve it? So if you think of someone who, needs like a hip replacement, but they've got lots of diseases that make it risky, you go, is the pain so bad that you're miserable all the time? Or are you just happy watching TV and not mobilizing? Okay, great. If that's the case, why would you want to take a 20% death risk? But if someone like, look, I was an athlete, I want to play with my grandkids, I am in so much pain and this operation could fix that, I'm willing to take that 20% risk. That's the kind of conversation I have. So that needs a lot more planning. And these days, we deal with patients in the western suburbs, and often they just have less access to stuff. It's a lower socioeconomic environment, which means that sometimes people come in having seen a cardiologist years ago, and then it was too expensive to see one, or it was delayed, or something happened, and they were just lost to follow up. Or they're in a place where all their mates smoke, so they keep smoking, keep deteriorating their health, and it's really heartbreaking because it's hard to make their conditions better when they're in that environment. Whereas if they were, in a better situation, living in a better suburb, maybe with better socioeconomic supports, they'd have that fixed like this. So yeah, that makes it hard.
Yeah, interesting point actually, because I think there's a lot of actual science, in terms of what we do with probabilities, risk mitigation.
Yeah,
And,
yeah.
you know, I think of it quite simply, very similar to what you think of in terms of, you know, I look at the risk of the surgery. So we can sort of classify as low, medium, or high risk. And then we look at the patient, you know, low, medium, high risk. And then there's a little matrix that you can add together. And with that, then you can think about sort of how you go about whether there's time to actually reduce the risk for the patient. And as Lars said, then the skill set or the human value, which will lend itself to, I think you've got a question in terms of with AI, but this is where that I think that human interaction, which you can't replace, which is actually going and talking to the patient and helping them understand what's involved. Because ultimately, you know, when you tell someone, oh, you got a 20% risk of dying, most of them will go,
Yeah, because the thing.
what does that mean? Does that mean
20%.
Does that mean that's still? Oh, so there's an 80% chance of living then, you know? And you're like, okay, it doesn't really, you know, go that
Actually,
way.
there's a thing that if you present the data as, let's say, more realistic is you have a 1% chance of death, people are more often going to go, whoa, no. But if you say there's a 99% chance that you'll get through fine, oh, that sounds good. Let's go with that.
Empty, glass half full.
Yeah.
Exactly. So you need to, ideally, we present, spend a lot of time presenting that stuff, which maybe could be done a lot better as well.
Okay, that's good. Let's talk about something else now.
Yeah.
Could we just talk about how you cope with your demanding shift hours, both physically, mentally, and socially? Well, we kind of touched on that at the very start, but we could like dive more into it.
Yeah, do you want to go first?
Yeah. So,
Okay.
look, I think with our job, there certainly is a lot of demands. And, you know, I think that, again, you have to sort of understand yourself, understand the people around you and the supports that you have. I'm obviously very fortunate. I've got, you know, a very supportive wife, family, and they enable me to obviously do, you know, the things that I do. And you know, certainly would not be sort of possible, you know, without them. And I think that's sort of the tenet in terms of making sure that your work, your life is in sync. You know, you need that sort of balance because you don't want to have, you know, your life affecting your work or vice versa, your work affecting your life, because it's just a complete sort of vicious cycle. So, you know, with that early starts, late finish, the big thing that I would say is, for me, what keeps me motivated is the goals. You know, having the vision in terms of what I would like to achieve, and you know, knowing that you hopefully are actually providing value and service, you know, to our community. I think that's one of the big things. You know, just sort of giving back is really sort of a big motivator to do what we do. You know, like you think about, you know, all the things that we do in terms of, you know, our podcast. We do after hours on our own sort of personal time, and this is outside our work. And we do that because we know it's rewarding. And similar to, I think, when we're there in our work, we know that, you know, we're helping patients through a very challenging time, through, you know, their surgery, through their perioperative journey. And albeit small, but we can often make a big difference in terms of the way that we approach them. You know, you're positive, I'm positive. I'm always, you know, to patients, telling them and reassuring them that, you know, I'll look after them and I'll make sure that everything goes well for them. Yeah. And to the best of my ability. And I think that sort of reassures patients immensely. And they're comforted to know that, you know, through that whole journey, I'll be there with them. And I think that's rewarding in itself. And I think by having those motivations there, that actually helps alleviate stress a lot. I'm sure with you guys as well, with your exams, you know, when you look at the stress that you have to undertake with, you know, your you know, as you're approaching ATARs, if you sort of think about it in terms of why are you doing this, right?
Yeah, that's true.
It becomes very stressful.
Yeah.
But if you actually go, I'm actually doing this because I want to achieve this, that actually continues to feed your enthusiasm and your motivation. So I think there's positive stresses, and where you don't want to be is sort of, you know, in that negative spiral where that negative stress negatively impacts your life.
I think that's a really great answer. I think it goes down to, you know, what are your values, right? So again, taking a step back, what are your values? And this will change over time. Because when I was in high school, I didn't really think about this. I just wanted to make sure I got marks, and beat my sister. And, you know, like I was just,
And he loves his sister.
yeah, like she's the best person ever.
Yeah.
She's way better than me. And pretty much everything. I just knew that it was a bad value set, but that's all I really understood. And, you know, I was such a dick, really. But yeah, so I you know, your values will change over time, and hopefully.
But that was what was motivating you, and you know, driving you forward.
Yeah. So having a good set of values is very good. I think my values are pretty, you know, values of, you know, doing good and making sure that you're, you know, kind and compassionate and you're generous and charity and all these other values are really good. And to know that to get to those things, that your career, if it's anesthesia, will require you to. So the question was, what do you do when how do you balance work life and everything? And just to know that the realism is that, you know, life is demanding, life is hard, and a lot of people struggle, and it's totally fine. And hopefully through your training period, you have chosen good values that you're going, oh, well, I'm going to be extra stressed during this training period and this exam, but at least it's for a good point. I'll be overworked and stressed, but I've got an end point for that. It's for a purpose, and hopefully it does have an end point. So then your values are good. You have these brief moments where things are a bit hectic. I'm going through a hectic period now where I'm just delivering lots and lots of courses on the weekends. But now after that, I'm going to drop a day and I'm going to kind of go back to having more balance.
Yeah.
So, but then that's kind of on a broader scale. But then on that micro scale of, you know, sometimes you're a bit unwell, or you've had a family tragedy, or you know, something happens and your work day looks ridiculous, or you're doing back-to-back on calls and stuff. Firstly, you've got to know that, like, we've got a very supportive department. So if you're unwell, you can get someone to cover you, and that's absolutely vital. You don't want to
The external supports are just incredible.
You don't want a half-assed anaesthetist giving you an anesthetic. You want to make sure that, you know, well and everything. So to know that if you are, what to say, halt, so hungry, angry, late, tired. If you are one of those things, you know, think about what that means, and are you actually able to go to work? So we really think hard about that. That's not a luxury for everyone in the world. Like, sometimes you just have to go to work no matter what, because there's no one else to do it. But hopefully in, you know, the Australian Western context, where we've got lots of supports, that you absolutely, you know, look at that. And then, you know, if you start to see your life getting out of balance, like, oh yeah, you're working too much because you've got a crazy big mortgage, or you've started, you know, spending way too much money on something that's not a very good value set, you keep refining it. And that could be anything. Like, you know, like, there's times when you're really social and you go, I'm too social, there's too many dinners, I need to kind of do more work. Or sometimes where you go, okay, I've done way too much work, I need to rebalance that and see my mates and have my, you know, social supports and stuff. So constantly thinking about your value set and refining your work-life balance, I think it's a lifetime project.
But supports are so important, aren't they? You know, like, and knowing that they're accessible. I think one of the hardest things for a lot of people who struggle is that they feel alone. They feel as if they don't have those supports available to them. And I would hope that, you know, Australia is a really great place in terms of they make these supports accessible. And I hope that people know that, there are people out there who care. Yeah.
Actually, that's probably the one thing, you know, your careers and everything important, but in these years of, you know, high school and then university, if there's one thing you really want to invest in, is just invest in your friends. They might have done something a bit bad and been a dick about something, but it doesn't matter. You forgive them and you have a chat, and then you just keep those friends, because they're the ones that will kind of save you when things are hard, when life gets hard. So,
Agree.
I think what we're also kind of picking up on is that you guys have recharacterized your, like, anesthesia as something you really love. And I guess that kind of answers what we're going to ask, that what makes you, like, excited to wake up each day and you know, go to work? But no, you guys have clearly, like, told us about that. But
that's a good question. So if you believe that you should have been, like, you know, say you did 5 years of anesthetics, and then something told you that, actually, you know what, the day-to-day of this doesn't suit me. There's a whole thing called sunk cost fallacy. And I had a really close mate. We did the med-surg exams together. He was doing cardiothoracic surgery, high-end stuff. He was about to graduate, and he realized that this is not compatible with the home life I want to see my kids and my wife and everything. And so he quit cardiothoracic surgery, about to be a surgeon, and did anesthetics. And I think that's a really great decision to know. It's like in poker. You got all this money riding on it, and they're about to, you know, to flip the last card, the river. And if it's the wrong card, you don't bet more. You go, you know what? I've made the losses. I'm not going to do any more losses. To know that there's a better option, that if you've chosen the wrong path and you're sure about it, you shouldn't keep sinking more time and effort into that. So sunk cost fallacy is a really important thing with knowing, is anesthetics the right career? There's plenty of people where it's not the right career for them.
It's definitely this balance that you have with anesthetics that you guys, I guess, compared to other specialties, that you guys can have a life.
Yeah.
Yeah, I think it goes both ways. I think, with everything that you decide to do, specialists, non-specialists, you always have a choice.
Yeah.
And, when we sort of talk about balance, and I was always told this right from the start, whilst we always talk about work-life balance, there probably isn't such a thing as balance, And classic example is that, Lara and I, we enjoy what we do, and we go above and beyond, what we do just in our professional lives to go and do other things that we really are passionate about. And when you look at that, you go, is that work-life balance?
It's like a better term is work-life rebalance. You're constantly rebalancing it.
And I think it all has to do with your value set. And it's true, I think, when you're young, certainly the value sets are very, yourself, very personal, and that's okay. I think, you need that in order to grow. But as you get older, to make, I think, that value set sustainable, and for you to wake up every day thinking, you're happy to go to work. At the end of the day, you're going, you know what? Yeah, no, that was really good. And, happy to sort of see your family when you get back. It needs to be something that goes just beyond yourself. It needs to be something that I think helps others too.
Yeah.
For it to be sustainable long term.
Yeah, absolutely. And it is a combination of like the task itself, the hours and the way it's organized. Sure, the people you work with, and if there's generally people all of a good, positive nature, great, that makes work easy. I read this thing, I don't know I wish I knew this stuff earlier, which is job satisfaction. If you take away the people, like the job itself is three things: autonomy, sufficient complexity, and reward for the effort. And so there's only a few jobs that do that, right? So the simplest thing would be starting a business. That means that has all of those things, but starting a business is very hard, not for everyone. Definitely medicine does have autonomy, reward for effort, and sufficient complexity. So that, to be able to find something that gives you that is, I think, a real privilege. Yeah.
I think this is why it's good that we do this podcast.
Yeah.
High schoolers don't end up like your colleague who, they've completed this like very strenuous road, high pressure, and then they realize that it doesn't align with what they want for their future.
Yeah.
So hopefully that we have less of that, and we can have like very purpose-driven, a new generation of very purpose-driven individuals.
Yeah. It's interesting you say that, because I actually have a different perspective on that in terms of that. I kind of think your friend needed to go through that journey in order to have that realization, that wasn't for him. And, it goes back to the point where there is no such thing as a right or wrong journey. This is your personal journey. But the most important thing is that you continue to self-reflect and understand yourself and know what you want.
Yeah, it's never too late.
It's never too late, correct. That's the main thing,
Yeah, that's right.
It is very philosophical.
That's what you expected from your philosophy podcast?
There is this balance. Yes, there is a big emphasis on your career in this economy, but it's also important that we take a step back, look at ourselves, look at who we want to be as humans, because at the end of the day, I hope that you guys agree that we aren't defined by our titles. And
that's right.
Advertiser through this podcast, saying, they're an anaesthetist, they're a medical student. That what it really comes down to at the end of the day, in terms of satisfaction, is just who you are.
Correct. You meet some amazing people, I'm sure, and hopefully you do this. Hopefully you interview, not just anaesthetists, but other professionals out there. And when you hear their stories, sometimes they're just as inspiring. I love watching, those Instagram shorts about even just stay-home dads who cook the most amazing meals. My wife shows that to me all the time.
I don't know if you're getting that one, but I'm not a dad, and they keep showing me things that you should be doing with your how to play with your son and play games. I would love to do that, but
you have no son.
I really always cooking up big sashimi platters.
Yeah, I think
we see the same.
I think my wife and you share the same Instagram page.
And then it's hilarious.
That's what it is.
Yeah.
Okay, now let's step back from philosophical stuff and then like to more the audience, right?
Okay.
How do you even get into anesthesia in the first place, and like what are the qualifications, right?
Oh yeah, easy. Yep. So you have to do med school these days. It's either postgrad or undergrad. There's still undergrad course out there. They're like 5 years. Postgrad's 4 years. Generally, you want to do that well. So finish it well. Hopefully, have some kind of research started there, and maybe a prize if you can try to do that. You know, like it's competitive. So, and then you become an intern. And you become a resident. So you become a provisional registered doctor. Then I think internship's now 2 years, but you're still intern then resident. Those terms are for someone who's a general doctor, not in a training scheme yet. So intern, resident. The resident years can be many years because you're still just trying to get onto a program of training. And with anesthetics, generally after the resident, you do a senior resident job. We call it a critical care HMO job. HMO and resident. Synonymous terms, house medical officer, same as a resident.
Yeah.
And then you apply for the anaesthetic training program, doing whatever method around Australia. And yeah, you have a good CV, you have good references from people you worked with, from consultants that you worked with. And then you go hopefully be shortlisted for an interview. And in that interview, they ask you a bunch of questions over 20 minutes and give you a mark. And then you get on the training program. Once you're on the training program, it's 5 years. You just have to complete two tough exams, the primary exam, which is what Anesthesia Coffee Break's about, and the final exam, which I do a lot of courses for. And so you do those exams, you make sure you have enough of all the different skills you need, that you've done lots of epidurals for laboring people, or you've done a general anesthetic in this situation. So you do all these skills, get them signed off, make sure you've done all those things. And some people go on to do a specific subspecialty, like doing regional anesthesia, which is blocking nerves, or cardiac anesthesia, which is doing the cardiac, open heart surgery anesthetics. And then after that you graduate. So after that you then you decide on whether most people generally either want a public job, a private job, or a mix of both. And it is a tight job market, but generally speaking, there's always work out there. You just have to, find it and compete for it.
That kind of selection period that you're talking about before the training program, that selection just recently happened, correct?
One of them happened. So I hire the critical care HMOs, the unaccredited, the non-training registrars who are about to get into training. But the interviews are happening pretty soon for the Victorian Anaesthetic Training Scheme. So they'll happen in the next few weeks, or end of August. Yeah.
So as like a registrar, what are you doing to like kind of gear yourself up for this specialty training? Do you kind of, can you assume a role of like, I don't know, shadowing or getting close to being an anaesthetist in that period?
As a registrar, that's the training term.
Yeah, before the training program.
So as a resident, you'll sometimes you'll get an opportunity to do an anesthetic job. And that's just like any other medical job where you're supervised by a consultant and you're kind of doing the beginner level stuff of the job and slowly gaining skills. So yeah, absolutely the thing to do is to, whatever job you want, you try to shadow a person or have the job, the training job in the job that you want in the future. So that's absolutely right. And yeah, you'll probably get a sense of, whether it's for you or whether it's not. And in that time, like in those training, pre-training, pre-registrar years, you want to, because it's so competitive to get into any of these things, whether it's med school or anesthetic training or surgical training or whatever, you try to do all these things that, are part of the selection. So having research, having teaching, having prizes, just being a good person, just getting good references and going above and beyond. And even if you're doing it for a specific aim, the good thing about it is once let's say you're a little bit nuts and you're like, I'm going to try and be good just to get a reference, which is probably the wrong thing to do. But hey, you know what? If you're faking being a good person, you'll probably end up being a good person. But don't worry. Even if it's for the wrong reasons, do good and worry if it's for the wrong or right reasons later.
It's quite a little bit nebulous, isn't it? The registrar position that you were mentioning. So with anesthetics, we've got this thing called accredited, unaccredited registrars. Most registrars will probably be accredited in anesthetics. I know that in other specialties, such as surgery, probably the ratio between unaccredited and accredited, I think it's almost like 50-50.
Oh, wow.
Maybe even in medicine as well. In physicians as well. Whereas in anesthetics, I would think it's probably like 20% unaccredited, probably 80% accredited. So essentially, when you're accredited, it just means that you're in a training program, whereas when you're unaccredited, it just means that you're not in a training program yet, but you assume the responsibility that you would as an anaesthetic registrar. And, going back to sort of last, in terms of summarize, what's sort of required, the median amount of time it takes for you to become a specialist, anaesthetic specialist, will probably be about 14 years.
That kind of time period, from what it sounds like, it's kind of this like liminal state between, yes, you're a doctor, but you're not really specializing in anything yet, right?
Yeah. It's funny, I think when you're in it, like, you don't see it too far ahead. I know now that I talk about it now, like if you told me, hey Stan, as a 17-year-old, it's going to take you, 15 years or 14, 15 years to become a specialist.
Sounds insane.
I'd be like, I'm 17 already, double my life to get to where I want to be. Do I really want to do that?
Yeah.
But I think, when I entered medicine, internship, residency, and then registrar, there are so many like goalposts, like just like a year ahead.
Yeah.
So much so that you don't actually look too far ahead. So what I mean by that, with medicine, you got your exam each year.
Yeah.
And then after that, you're like, oh, I need to get into internship, And so you like try to, do all you need to do to get into the internship that you want.
Lots of small steps, right?
Lots of small steps. And then after internship, you're like, oh, actually I want to do, that residency. And then after that, you start doing all these little small things to get into that residency. And then you're like, oh, I want to become an anaesthetic registrar. And then as Lau was saying, then you start doing, again, being motivated to do all these extra things. And then you get into registrar training, you're like, oh, I need to do an exam. And so the exam comes along and you're like, oh, that's great. And you're like, oh, another exam's coming up.
You'd almost say that if you're definitely if you're a high school student, even a medical student, you probably don't even know what the right thing to do is. So again, with that Tim Minchin thing, he talks about he doesn't have big goals. He just has the short-term accomplishment of lots of little goals. So just what's right in front of you, just be real passionate about that. And who knows what's going to happen, because there might be an even better opportunity that's just glinting over the side of your eye.
Yep.
Far better than any career you thought in medicine, surgery, engineering, law, whatever it is.
Yeah.
And so it's almost like if someone said, hey, it will take you 14 years to grow a beard. Like, you're not stressing about it when you're born. I'm going to have to crawl. I'm going to have to walk. I'm going to have to...
I don't know why you use a beard example. You just know I can't grow a beard. That's all, It's going to take longer than 14 years.
Sorry, maybe this is the wrong audience.
All right, I think we might begin wrapping up, but before then,
good.
I think we can go through some rapid fire questions if you don't mind.
Yeah.
Maybe, one sentence response to each of these. So first, what are some common misconceptions that people have about anesthetists?
That we leave the theater, so we just put them to sleep and leave. That's definitely not what happens.
Okay, if you were an anaesthetist, what would you be doing right now?
I would probably do something in tech, I would think, and teaching. I think those are sort of my two main passions. And certainly, I think I've got avenues for that already if I decided not to do anesthetics.
Yeah.
How about yourself?
I think I would have... I signed up to science law for no reason. Then I was like, well, I could barely do another degree. But I think I'd probably be an engineer. Like, I can see that being part of it.
Yeah.
Do you ever think that AI will replace some area in the medical field?
Yeah, and that's good. Like, just don't try to halt progress. Just make sure you invest in the thing that's going to replace you.
Do you think it'll come into anesthesia?
Yeah, absolutely.
100%. Yeah. And look, I think it will help augment patient safety.
Yeah.
I think that's the sort of the main key driver. Look, one of the things is that patient communication, I think, will still be a very human, process. But certainly in terms of decision making, I think AI has a really, really big role to play, because AI at the end of the day is all about probabilistic, language modeling, based on previous experiences. In other words, what it will say and what it will do has the highest probability of being correct. Yeah. And that's what, I think when you look at delivering information in terms of a very black and white process, that's what you want in terms of what is the most likely thing to say, but then how you go about interpreting that and saying it, there are multiple nuances that I think AI can't do just yet.
Yeah. It doesn't scare you that AI might come into your field?
I think we need to embrace it. Like, there's nothing to fear, like there are so many opportunities out there, and ultimately, what's the goal? What's the end goal? The end goal is really about, I think, making life better for everyone. And not just, for a certain select of the population, but I think also, in terms of equality as well. And I'm really a big believer in terms of tech accessibility and equality.
I think the scary thing for a lot of people is that AI comes in and makes a lot of professions much cheaper. So a lot of very, maybe wealthy people or well-paid people lose that salary. I think that's not the worst thing. Like it sounds controversial, but it's probably a good thing that lots of service, like it's a whole governmental thing that we need to use technology to to give support and welfare to the most people when they can, but also make sure that you share that wealth with everyone. And it's a whole thing. It's a whole political thing. It's a whole socio-cultural thing as well. But whatever it is, if you were a taxi driver back before you became, and you put your head in the sand and ignored it, then you can't stop technology and fight it. You have to go with it and invest in it, and don't have your head in the sand about this stuff.
I'm always a big believer that in terms of wealth, whatever you define wealth is, will always find its way to people who are willing to give it to others. That's my big thing. I find that in terms of that positive energy you sort of give out, you'll get that all back. And however you define wealth, and whether it be monetary, whether it be family, life, love, what you give out is going to be what you receive back. Absolutely.
I think I totally agree. In the high school context, I remember my sister especially, she was so helpful. Like she just helps everyone, So it's one of those things where the more you help, so she's a fantastic teacher and one of my inspirations, because she would just teach everyone, including me, how to do something. So she became very good because of her generosity of teaching. And I find that happens now as well. Like, you teach something so much, it means that when the thing happens, it's like, I've been teaching this for years. Like it's a very good thing to be just generosity of that.
And one final thing, what advice would you give to current medical students and current high schoolers at this moment, like aspiring to become doctors or something? Just one thing.
Yeah, easy. I'd say just to know that you'll be fine no matter what. Like just have good values, and that's all that matters. So forget STEM, forget acting, forget being a superstar, forget being a TikTok celebrity. Just have good values, because your happiness and well-being will be not defined by any of these things, but it'll be by your value set and the people you have, the good people you invest in around you and your connections. That's literally it. Just don't worry so much. Have your goals and fail at them, and be happy every time you fail.
Yep. And going on to that, for me, there's no such thing as a mistake. I think there's a lot of pressure when people start advising you to say, do this so you don't make this mistake, do that so you don't make that error. For me, that's life. What is more important is how you go about learning from those situations. And I think that's sort of the key thing that, I want sort of the young people to know, is that these things will happen, and you don't go about trying to prevent them, but rather what you want to do is you want to embrace them and go, what can I learn from them? Because when you do that, you become so much better on the other side.
Well said.
Yeah. Life is, the best teacher.